one of the things that we can give other people are stories, are the kind of proof of life, so to speak, that someone else has been through something similar to what they've been through. And for me, after my daughter died, that was my lifeline. I was handed over a dozen books, and it took a while before I could really focus and read and have the attention span. But once I did, those books became a lifeline for me because it was proof, right? It was proof that these other individuals had gone through child loss and had survived, and that if they could survive, I could too.
I saw it at the hand washing station at the entrance of the NICU. I see it in the playroom during medical play bingo. I see it near the fish tank in the surgery waiting room. There is a powerful unspoken language between two parents who have never met, but know in their deepest soul what the inside of a children's hospital feels like. It is joy and it is grief. It is love and it is fear. It is miracles and it is loss. This podcast exists to tell these stories. I'm Katie Taylor, a very proud child life specialist, and it is my honor to be your host of Inside the Children's Hospital. Hello, my friends. I'm so glad you're here. Welcome back to Inside the Children's Hospital. I'm your host, Katie Taylor. This is a place where we share the lived experiences and real stories of parents who have supported their child through healthcare experiences. This podcast is all about helping families feel less alone, more understood, and more equipped and ready to advocate for their child while navigating some of the most overwhelming moments of medical life. Today's episode is a very meaningful one. I'm joined by two incredible guests today, Mahaley and Emily, and their work and lived experiences came together in a way neither of them could have predicted. Mahaley is a licensed marriage and family therapist specializing in perinatal mental health, and Emily is a licensed clinical social worker, writer, and also certified in perinatal mental health. Together, they created a beautiful resource called Your NICU Story, reflecting on your family's experience. In our conversation today, we talk about how their paths crossed, what led them to collaborate on this specific book, and why creating this safe space for families was so important. Mahaley also shares about her beautiful daughter, Sachi, who died after a NICU stay, and the love, grief, and purpose that continue to shape the way she shows up for other families, including you. Emily brings her own perspective too, including the family's PICU experience with her son and how those moments of being truly seen by providers stayed with her long after the hospitalization ended. What I love so much about this episode is that it reminds us that our stories are not just stories, that they can be lifelines and they can help us make sense of what happened. They can give us language to experiences that felt impossible to hold at the time. And sometimes hearing that someone else has survived something unimaginably hard gives us just enough hope to keep going. You'll also hear us talk about something I care very deeply about, and that's the gap between support families need and the resources they actually receive. And as a child life specialist, I know how meaningful it is when the right resource gets in the right hands at the right time. And this book is one of those resources. This book beautifully supports NICU parents, partners, caregivers as they process, reflect, and honor their story in their own time and in their own way. This episode is for NICU families, for bereaved families, for providers who want to care more thoughtfully, and really for anyone who has ever needed proof that their story matters. Let's get into it. Here's my conversation with Mahaley and Emily. Even though the interview hasn't gotten started, they have confirmed this is their favorite podcast they've ever been on before. So we'll just go ahead and say that. But why don't you guys introduce yourselves and just tell us a little bit about you and your background and your family and a little bit about why you're joining us today.
I'm Mahaley. I am a licensed marriage and family therapist. My specialty is in perinatal mental health. I am currently in Vancouver, but I live in Nashville, Tennessee. I have four kids. My oldest is almost 9. My daughter, Sachi, would be almost 3. I have a son, Kaya, who's 16 months, and a daughter, Archie, who is 10 months.
Oh my
A
goodness.
wild bunch in here.
Wild bananas. Okay, so now I know that you're in Vancouver and your husband went there and you went with him and now you have other family coming in.
So there's a lot of people. Yeah.
Yes, yes. I
A
love
lot of
it.
people in this house.
Amazing. Well, and how amazing that your professional experiences is probably very much shaping your experience in motherhood for the past decade and vice versa.
Yes, and vice versa. Yes, yes, absolutely. Yeah.
Awesome. And Emily, tell us a little bit about you.
Yeah, so I am in Maryland. I'm also certified in perinatal mental health. I'm a licensed clinical social worker, and I have 2 children. They are almost 11, which I can't even believe how that's possible, and 8.5. And there's always that like elusive work-life balance for me because we have decided that homeschooling works best for us for our kids right now. So I'm always trying to like find and balance the time to work and the time to be with them. And I'm also a writer, and I really enjoy doing workshops and trainings for other providers and just parents in general.
I love that. Well, what made your paths cross and how did you guys team up together?
So I was aware of a book that Emily had written called Birth Story Brave, which is now Birth Story Reimagined. But at the time that it came across my desk, it was just Birth Story Brave. I do a type of trauma therapy called EMDR. And so because of that and working in perinatal mental health, I saw and see a lot of birth trauma clients. And a colleague and a friend recommended her book to me for working with birth trauma clients. And it was the first time that I can remember really seeing firsthand the power that writing and telling your story and the use of narrative work can have in a therapeutic setting. And so that was probably 2020, 2021, 2022. Fast forward to 2023. My daughter, Sachi, who would be 3 in February, died after a NICU stay. And when I decided to go back to work, which was a really tough decision being in the space that I was in before, I decided, if I'm going to go back to work, I'm going to do it with purpose. I'm going to really kind of fine tune my focus into working with NICU families, having had a NICU experience, and also working with bereaved families. So I do a lot of writing now personally. And it had kind of entered my mind here and there. Like, I really would like for there to be a book for NICU families, a book that could be a tool for them to help them as they move through their experience. Because I think what I learned in my own NICU stay, obviously having the worst outcome you can have, is that regardless of your outcome, regardless of your duration, the duration of your stay, the majority of families walk away with a pretty extensive amount of trauma. And I kept coming back to how Emily's book was formatted and the way that it was written. And I was like, that's kind of how I envisioned this being done. And I just decided to reach out to her. I had never written a book before. And so I knew that I had the idea and had a pretty kind of clear idea of what I wanted to look like. But I thought that she could bring a lot of value. Obviously, I have the personal experience, but we're both professionals in this area. And she's also an author, and I wasn't at the time. And I just introduced myself, told her a little bit about our story, told her a little bit about my idea. And that was a little over a year ago now. And we got on a Zoom, and that's that's the end. That's the end of the story. We started collaborating kind of right after that. And I think we were kind of both always pretty clear and aligned on what the book would look like in terms of like its use and who it would be for, who its audience would be.
Yes. Emily, I want to hear from you. I want to take a moment though and just thank you, Mahaley, for sharing with us about your daughter, Sachi.
Thank you.
And it means the world that you would come and talk about her here on this podcast. She is so important. And if she at all is the reason that you're getting to help other moms right now, I, for one, am so grateful to be able to have this platform to share more of her and you with the world. So thank you so,
Oh,
so much for being willing to talk about her. And I want to hear more about her and your experience whenever you want to share it. So thank you.
Definitely, this book wouldn't even be here without Sachi, so we're so grateful.
Oh,
I'm so grateful.
yes. Yes, yes. So, Emily, this beautiful woman with an amazing story and a similar
Mhm.
background reaches out on Instagram. And I love stories that start on Instagram, having had so many friends that I actually have never met before and actually even come up in my dreams now that I know from social media is just wild. But how you can develop this relationship personally and professionally is pretty amazing. And what was it like when she reached out to you?
It's pretty wild, and I have so much, again, gratitude for just the way that relationships are able to evolve even when you've never met somebody in person before. So, um, periodically, like, I'll have some people send a message saying, like, "Thank you, this book is working for my practice in this way," or "This has been helpful." And those always feel really good because working by myself, I don't always hear back about these things, right? And so Mahaley had some kind things to say, but she also had this like kind of plan or this idea. And I was very flattered that she would reach out to me. I was excited about connecting with her. And once we did connect, I just felt even better about it because it was really easy to talk to her. And it, like she said, a lot of our ideas sort of just naturally aligned and we were able to kind of create a pathway forward with relative ease. And I always like I've said this before to her, but I just had this sense of like, are you sure I'm the one that you are you sure that I'm the one you want to help you with this? Because I was very aware, of course, of like even though I've worked with families that have had NICU experiences, I hadn't had one myself, not with one of my babies. So I had volunteered in a NICU setting. So when I was like 15, I volunteered at a hospital and at least once was placed in the NICU. So I had had some exposure and then working with families, but I had only ever had a PICU experience with my son, which just as a side note, the child life specialist who came, she was the first person I was able to cry to, was when, like, they had taken him for a procedure, and I felt a little bad about just kind of, like, unloading on her, but she came into the
Yeah.
room, and she was the first person who just sat, and she listened, and she validated, and she was amazing. Um,
Oh, glad you
but
had that
anyway,
support.
yeah, it was incredible, but so I just really wanted to make sure that I was what Mahaley needed. And
Mm.
she confirmed that she felt yes. And then I just felt really excited about moving forward. And it's been sort of a whirlwind with how quickly the past year has gone. But again, just so grateful for that whole process and the different connections we've started to make. And the book has been really well received, which is huge.
Mm. I have so many questions. I want to talk a little bit about I love the way that you guys are approaching supporting families. So I was started child life services in one of our NICUs here in Austin, and I was one child life specialist to 80 babies. And my clinical counterpart was a social worker who was social worker to 80 babies and another 60 moms. So if you can imagine, like there were not a lot of resources to go. But one resource we can duplicate and give are stories and books. And so I love that clinicians like yourselves with lived experience are making these resources to make our jobs easier so I can hand a mom a book and know that she's going to be in good hands a little bit. So I just wanted to say thank you for that because the delivery of resources from hospital to parent is a gap that I've been trying to fill with my app, with this resource, with this podcast. And so yours is another one that fills that. Let's back up and talk about the name of the book, the title of the book, and who the book is for and what it's about.
The book is called Your NICU Story, reflecting on your family's experience. And the thing that makes this book really unique is not only is it for moms and birthing parents, but it's also for partners because we realize that a lot of times those stories get lost in the shuffle. Everyone's stories really do. The ability to be able to slow down, to be able to have a place to walk you through, like guide you through gently, a way to get curious about what you experienced because it's hard to know where to start. And so we aim to really have like a pathway that we lay out. The book starts with some stories from, Mahaley shares about her story. Her husband, Ravi, wrote a chapter, and then we have a chapter about the queer experience because obviously there are so many, and those are just, you know, a few of countless experiences you can have, but our hope is that there are threads of relatability throughout those stories and things that people can learn. But then we transition into guiding readers through questions, and all of the questions pretty much are meant for whoever they apply to, and that can be partners as well. So any parent who has had a NICU experience, and that doesn't have to have been in the past year, that could be the past 5 years, 10 years. We always think that there's space for the story to be expanded and held and told. So
That's such a good point about timing because it's interesting. All like the woman I just interviewed before you all, her child's experience was 5 years ago. I've had 18 years prior, 30 years prior. Sometimes it takes that long to be able to actually process and regurgitate what happened and who was I and who am I now. So that time limit is good. It's not a resource. It can be delivered right now and here you go, but it can also be retroactive.
exactly. Yeah, because this is the kind of resource where, it might be good to have once you're home. When you're in the NICU, you're still very much in it, right? And processing. I mean, I can see like giving this to families, and our vision is to have it in hospitals to be able to go home with families as a resource.
Yeah. Mahaley, did any of your expectations about the book change after actually working on it with Emily?
I think it became more expansive and comprehensive than I first envisioned. I knew that I really wanted it to hopefully feel relatable to the majority of NICU families, which I think is a tall order.
It is,
I
yeah.
generally think in life when we try to speak to so many, sometimes we can take away the value, right? Of like, as opposed to just really being niche in what we are, what we're attempting. But I really wanted it to be that. And I think that that is a tall order, right? Because NICU family to NICU family, you vary in your duration, you vary for the reason why you're there, you vary in your outcome, you vary in your socioeconomic status, you vary in the hospital that you're in and how many resources there are in that hospital. I think that there's so many ways in which a NICU experience can vary. My hope is obviously I know every question, every reflection, every story won't speak to everyone, but I hope that there's something that each family that, ends up with this book, I hope that there's something that they can take away from it.
And now a word from our amazing sponsors. We're so grateful to have Paine's Instant Topical Anesthetic Spray as our sponsor of today's podcast. Help control pediatric procedural pain associated with needle procedures and minor surgical procedures while improving patient satisfaction. Paine's Instant Topical Anesthetic Spray works immediately. It is a non-drug and non-flammable topical spray that can be used to temporarily relieve the pain associated with minor surgical procedures and needle procedures. Pain Ease is a medical device and does not contain medication. It can be a safe and effective alternative for lidocaine injections when used to temporarily control pain associated with immunizations, IV starts, blood draws, foreign body removals, and suturing or suture removal, to name a few. Pain Ease works on a 3-step process. First, prepare the site and equipment for the procedure per your facility's protocol. Second, apply Pain Ease by spraying about a can's distance away for 4 to 10 seconds or until the skin begins turning white. Finally, perform the procedure. The anesthetic effect of Pain Ease lasts about 1 minute and can be reapplied as many times as necessary. Refer to application instructions for full details. Important risk and safety information. Consult your pediatrician when using on children 4 years old and younger. Do not use on large areas of damaged skin, puncture wounds, animal bites, or serious wounds. Do not spray in eyes. Overspraying may cause frostbite. Freezing may alter skin pigmentation. Use caution when using product on persons with poor circulation. Apply only to intact oral mucous membranes. Do not use on genital mucous membranes. The thawing process may be painful and freezing may lower resistance to infection and delay healing. If skin irritation develops, discontinue use. Caution, federal law restricts this device to sale by or on the order of a licensed healthcare practitioner. Studies suggest that pain ease does not induce vasoconstriction, does not contaminate a site that has been cleansed, and is preferred by patients and practitioners. Pain ease comes in 2 different spray pattern variations, medium stream and mist. It is also available in 2 sizes, 3.9 ounces or 1 ounce single patient. Gebauer appreciates the care and comfort that you provide to pediatric patients. Visit gebauer.com/pain ease with no space to learn how pain ease can make visits more comfortable. One of my favorite questions is that if you guys could wave a magic wand with this book, what would that look like? And not only what would you do with the magic wand in terms of the book and what your dreams and desires are, but how do we try to be a little like gap closer in making that happen?
I think about what you said, and it may have been before we started recording, but you said that, one of the things that we can give other people are stories, are the kind of proof of life, so to speak, that someone else has been through something similar to what they've been through. And for me, after my daughter died, that was my lifeline. I was handed over a dozen books. And it took a while before I could really focus and read and have the attention span. But once I did, those books became a lifeline for me because it was proof, right? It was proof that these other individuals had gone through child loss and had survived. And that if they could survive, I could too. And though this book, it has a personal reflection from both me and my husband having gone through the loss of our daughter. And obviously those reflections aren't extensive, right? The purpose of this book is to be a tool for someone else. But if I could wave a magic wand, I think it's like 2 parts, right? I hope that for the people that are holding this book that maybe have lost their children in the NICU, that even my short reflection, my short story, my husband's short reflection and his short story can be proof of life for them, right? Proof that they can survive. And then I think too, the gap in the resources, which very much is there. I mean, we had, I think, as phenomenal as of an experience in Roe Carroll in Nashville, which is where my daughter was, as you can have, right? And even in that, there were a lot of gaps. And I often think if I hadn't been in the position that I was already working in the mental health space, what would the aftermath of this look like? And my hope is that this book will be in so many NICUs, available to so many families. And I think, like Emily said, I don't know that it's for families while they're in the NICU. I don't
Mm,
even know that it's necessarily for families when they've been home for a week or two, right? I think it's one of those things they're handed. It goes in the little pile of
yeah.
resources that sit on the desk. And that one day, whether they're a few weeks, a few months, a few years out from their experience and they feel like sort of going back, that they'll pick it up and they'll say, "Oh yeah, I have this book that someone gave me," and find some healing in it.
I love that suggestion. Like, let's give this as a book to open at your 1 or 2-year anniversary of
Mhm,
discharge from the NICU.
mhm,
Because there's still so much, like, that it's like you wake up and you go, "No, I did live that," right? Like, I know I'm a year out and there's different things and problems and obstacles, but and challenges and great things that are happening, but I lived through that. And I love this, like, promise, right, that you can continue to come back to it, and this could be the tool to help you. I always try to think of, like, how can we concretely make sure families get this? And if we give them the book at the NICU, okay, and then we say, "On your 1-year discharge day, your job is to open this book," okay?
I like that idea. I like that idea a
mhm.
lot.
I like that a lot.
Absolutely.
I actually think in some ways having a little bit of distance, right?
Yeah.
It's not a bad thing, having a little bit of distance to kind of process and then go back and reflect in this way.
Oh,
And
yeah.
we say this in the book too, but it's also one of those things you can pick it up and you can put it down. It's not something that you have to do from start to finish all in one sitting.
Absolutely not. Yeah, it's meant to be very accessible in that way and to for you to be in control and have autonomy over the pace that you're going and when you choose to dip into certain memories.
Can you give an example of maybe you mentioned that there were prompts and some, foundational parts of the book. What can parents expect as they go through it?
Yeah, so the book is set up sort of pretty much chronologically in terms of where your story starts. For example, whether this is something that the NICU stay is something that you felt prepared for at all, that you might have had an idea that this was something that was going to be part of your journey, or whether you didn't. Um, and starting there and just really with some basic parts of where your story begins, and then moving through. The rest of the NICU stay, talking about things like the full sensory experience. What did it feel like to your body? What do you remember? What does your body hold on to about being there? Which providers did you connect with? What were some ways that maybe providers could have done a better job at supporting you? Those are some examples of things that we cover. We tried to be really as comprehensive as possible. And then after we move through those parts, after the NICU stay, there is a split for people who took their baby home and people who did not. And so there is sort of a choosing of your pathway depending on what relates to your story. And I'd say that it starts, as far as the progression of questions, it starts more basic, and then things do get more into the emotions of it and reflections and get deeper as you move through.
Yeah. So it's almost like a journal prompt kind of to take you throughout, is that
Yeah,
correct?
it's
That's
very much like a
wonderful.
guided journal in that part, and there's even lined space within to use, both after each question, but then also at the end of each section, we provided some extra lined pages. But you don't have to write in the book itself. You're welcome to use your own journal. You're welcome to do a voice recording. You don't have to do it in the space we provide. There are lots of options.
I would love to hear some of the things that worked in both your PICU and NICU experiences of when the providers or the care team did a great job and things you liked and really stuck with you as meaningful.
So, our NICU experience was totally unexpected. My daughter was full term when she was born. She had meconium aspiration at birth, and it was pretty extensive. So, had an emergency C-section. Um, and she ended up on a cooling blanket, had to go through that whole process. So, weaning off the cooling blanket, EKGs, MRIs, et cetera, to just really understand the extent of the damage that had been done to her brain and her organs. And so it was a 5-day process that, from start to finish. She died around 10:30 p.m. on the 5th day. And I think everything about the NICU was a shock and surprise to me. I Now again, we're in a level 4 NICU. We are the worst case scenario, right?
Mm.
That is our lived experience. So I don't know that this is the experience for someone in a level 1 NICU or a level 2 NICU, right? But the amount of medical information that came our way, I think my husband and I are relatively intelligent people, and our ability to process, like having gone through just the shock and the trauma on top of my physical, like being post C-section, post emergency C-section, et cetera, the amount of medical information that we had to process felt inhumane. Like we were like, how are we supposed to process this, make all of these decisions, know what questions to ask, et cetera. So that always comes to mind in terms of something being a really kind of surprise element there. And I
Yeah.
think for my husband, that's where he holds a lot of his trauma, is in that experience of it. And he talks about that a little bit in his reflection in the book. In terms of, and I don't know that there's anyone that can help you with that, right? I think the doctors are doing the best that they can to help you talk through all the different scenarios and help you understand. But I don't know that outside of that, that there's really a whole lot that, anyone can do. We had to make an extraordinary amount of decisions in a very short amount of time. And I also think that that is not unique to us, but unique to just kind of a percentage of NICU stays, right? That you just don't have a lot of time in front of you. And it's hard to know what resources would have necessarily been helpful because I don't know that anything is helpful in those situations. What I do know is helpful is how, and it is still the thing this day when I'm so used to talking about the experience that I sort of like,
Yeah.
I can be on autopilot a little bit, but I can feel
Yeah.
myself like getting emotional. It's still the thing that gets me.
Of
What
course.
is so helpful is like when you're treated as humans by those people and when like they show how much they like, really care for your child. Like it just, it's a thing that still, I'm
Yeah.
not like on autopilot with it yet. Like her nurse that, made her little name sign outside the door, right? And in my head, I'm thinking, like, obviously, like horrible thoughts, like, she's going to die. Like, why are we making the name sign, right? And
Yeah.
I'm so thrilled that I have it, right?
Yeah.
She had many nurses, but one of the nurses that was um, on her rounds, right around the time of her death, like, stayed extra, right? Because she stayed overtime because she knew that, Sachi was on the way out. And she was one of kind of the familiar faces that we had, And um we had this other nurse that was with us quite a bit that told us, it was such an honor to care for her. Like, thank you so much for that honor. Right? It's those little things that those little like pockets of humanity, I think in those moments that go such a long way. And I think also they don't necessarily always go a long way in the moment because you have so many things in front of you that you have to deal
Yeah.
with
Right.
that are so, I mean, in our case, life or death, right? But they're the things on the other end that now I remember, right?
Yeah.
They're the things that like my husband and I take with me. And I think that it's such a tall order for someone in their position day in and day out, right? They're seeing a lot of really severe cases and worst case scenario situations, but to bring in those elements of humanity and of remembering at the end of the day that, this is my child's life, right? And this is about to be my child's death. And it's this horrible, life altering situation. And I think I can imagine from their scenario that it can be so easy to just kind of get numb to that. And in our case, I don't think anyone was, right? Even if they felt numb to it, they didn't show it. Like, and so I always go back to that I don't know that I can pinpoint resources necessarily because I just think what we were dealing with was so acute and um, horrible, but the way that we were treated. And I think that's why my husband and I still are really involved in the hospital and try to do a lot of work and give back to the hospital. And that's why, right? That's why. It's because of how we were treated, not necessarily because they had the best resources. Um, and we go back, we've gone back and spoken to groups of residents, and that is always the thing that I try to kind of get across.
Yeah. Thank you.
Mhm.
Yeah, so for us, it's interesting because the threads of things that were most meaningful to me were similar, though our story was very different. My son had a traumatic accident involving a tree where he had some life threatening injuries. And so, luckily, his PICU stay was only a couple of days by luck, really, is what it is, right? It's luck. And yes, we had good care, but a lot of it's luck. And as I mentioned before, having people sit and it's like Mahaley said, treat you as a person. Like the first person to really sit with me when my son was taken out of the room for one of the scans or procedures. I mean, there were so many things. And she just sat there with me and she just let me have my
Yeah.
experience. And that was so huge. And one of the things that was really confusing to me while we were there is that providers kept not referring to him by name. They kept, even though I came in with him with the ambulance, we knew who he was. They just kept calling him acute Kansas, like no matter what. Um, and I'm like, well, no, that's not like, so it just kind of felt like sometimes that he was a case, rather than a
Yeah.
kid. And the
Yeah.
people who took time to, like say his name and get to know him and learn about him, which I still, Child Life stands out a lot for that. And there were certain doctors who really did, who were a bit more warm. Um, and again, the care there was good, but the people who really took time to slow down with the human aspect of it, that was really helpful. The people who kind of explained things in a way that made sense, because
Yeah.
similarly to Mahaley too, like I consider myself to be a relatively intelligent person, and my husband too. But when your brain is being traumatized, you can't make sense of information in the same way. And there's a
Yeah.
lot coming at you, right? And so it just, anyone who kind of gave it that ability to like slow down and make us feel seen, and remember that my son wasn't just a cute Kansas.
Yeah.
It was such a funny, like I think that they did that, like they named like the states. They have like a process for
Um,
doing that, and you probably know more about that than I do. But yeah, that's what really sticks out to me.
it makes a ton of sense. And it's like when you reflect, you remember on the moments with the humans that you had and the ones that were really great and some of the ones that weren't so good. Um, and I was actually just on a grand round this morning for a hospital in New York. And we talked about that like the first 30 seconds that providers spend with families, or maybe the last 30 seconds after the intervention or whatever they need to do are over, tend to be the parts that families really remember. And it's almost like it's not fair that we have to ask so many questions and decisions of families in their darkest times, but that's kind of the way it works, and it's like a double-edged sword to both have the information, not be able to absorb it, and have to make the decision about it when you're looking at providers going, "No, shouldn't you be telling me what we should do next? Why are you asking me? I've never been a neonatologist before or an intensivist," or whatever that is. It's quite complex, quite complex.
Yeah,
I
it
want
is.
to thank both of you for number one, sharing your own personal experiences. And I think all of us, as the three of us, as storytellers, and knowing how important it is. It's just like you said at the beginning, Mahaley, is like knowing that somebody else went through it and survived after. It's just like you need that like little grip and
Mhm.
that little like glue to somebody else, even if you never meet them. And I think books and podcasts are such an amazing way that we can feel that for each other. So thank you.
Yeah, absolutely.
Is there anything else about the book that you wanted to share? And I would love for you to tell us where people can pick it up and how to get it and all that good stuff.
Sure. Well, just that it's readily available pretty much wherever books are sold. So that could be anything from Amazon or Barnes and Noble to your local bookstore. If they don't have it in stock, all you need to do is ask them if they can order it for you, and you can get it that way too. But yeah, it's pretty available, and we're so excited that it's out in the world finally.
Well, thank you so much to all of you. And thank you for sharing Saji with us and your husband, Ravi, and your whole family. Very, very grateful to know you now and to be able to share your book. And thanks for being here.
Thank you
Thank
so
you.
much. This was great.
For those of you who are joining us today, I am not a doctor. I'm not a therapist. I am a child life specialist. And the suggestions and tips and resources that I talk about with parents on this podcast may be great for you and they may not be right for you. So, the most important person you can talk to about getting support is your care team, your doctor who knows your story and your child's story. So, regardless of maybe what I mention or what other families mention here, we're not licensed therapists, we're not doctors. We're having a conversation about what the parenting journey has been like. So, please keep that in mind as you listen today.